Guys, in this video, we'll be going over the differences between Adderall here on the left and Ritalin in the middle, and the location which they target, which is the prefrontal cortex, depicted here in orange. So here's a patient without ADHD, and here's a patient with ADHD. As you can notice, this is from probably a positron emission tomography. There is more activity here on the left as opposed to an ADHD patient here on the right. And basically, a stimulant is going to adjust that. Cognition. They improve cognition in patients with ADHD via the enhancement of the prefrontal cortex, which is responsible for executive function, by increasing attention, impulse inhibition, perspective memory, and cognitive flexibility. Adderall comes in what's known as mixed amphetamine salts, meaning it's not one particular drug. It's the same drug, yes, but there's a D form and an L form. The D form will act primarily in the brain, and the L form will act in the peripheral nervous system, and will have those side effects like increased heart rate and the sympathomimetic activity, which means that it acts like the fight or flight state, that when a person is getting chased by a dog kind of effect, or let's say a lion, because some people are not scared of dogs. And then it targets dopamine and norepinephrine and serotonin, as well as it blocks monoamine oxidase. There's a ratio within the capsule of the D 3 to 1 ratio, the D having 3 and the 1 having 1 L. So it's primarily centrally acting, but it has some of those effects peripherally. Here is Ritalin. Ritalin, just like Adderall, has a D form and an L form, and these are enantiomers. It targets cognitive function as well in the PFC. And here's an image of a 10 milligram box of Ritalin. Vyvanse and Dexedrine. These are primarily in the D isoform, and therefore they act primarily in the brain, and they will have fewer side effects as a result. And Vyvanse in particular is a prodrug for the D-amphetamine. A prodrug is simply a drug that's not activated and has to undergo certain steps or a step to become activated. Vyvanse is a prodrug for Adderall, and it's called lisdexamphetamine, which means that it has a lysine attached to it. And once that lysine gets removed by an enzyme in the red blood cells, it becomes active and looks pretty much like, it looks exactly like D-amphetamine. Again, this is a location where the prefrontal cortex is located, and these drugs are gonna improve executive function there. Here's an image of Vyvanse, which is a long-acting, and here's Adderall IR and XR. The benefits of having Adderall XR and Vyvanse is that they're long-acting. They have a long half-life. A half-life is simply how long does the initial dose take to become halved. So if you have a 50 milligrams, how long does the 50 milligrams take to get to 25 milligrams? And since they have a long half-life, you only got to take them once a day. The IR, for instance, has to be taken every 4 hours in order for it to maintain its effectiveness. And with patients with ADHD, it'll make sense why they want to put them on an extended release, because they might forget to take their dose, their second dose or third dose. Ritalin mechanism, and this is how it acts in terms of molecular function. We have a neuron 1 here called a presynaptic neuron, neuron 2 here called a postsynaptic neuron. One, let's say, acts like a voice, and the other one acts like ears. Not literally, because we'll see the differences. Obviously not literally, but there's some slight changes to that analogy. So the voice sends a signal, these voice particles, which are neurotransmitters, and then the ears are the receptors. The more voice you send, the louder, the more voice particles, the stronger or likelihood of the message being heard, right? And there's a way that these voice particles are taken back into the ear. That's the part where it's not a good analogy, but the voice particles can be taken back into the ear, so the voice, so the signal can be terminated basically. And the methamphetamine, which is Ritalin, can block that, which makes the signal last longer, and therefore it's stronger, and you're more likely to have, let's say, more dopamine or norepinephrine, which are the neurotransmitters that are relevant here in terms of methamphetamine. And in the next slide, we'll look at Adderall, which targets more neurotransmitters such as serotonin as well. And it will have more mechanisms of increasing the amount of neurotransmitter available. This is Adderall. Big picture, it increases more neurotransmitter types, dopamine, norepinephrine, and serotonin, which is 5-HT. 5-HT is the same thing as serotonin, 5-hydroxytryptamine. And what it does here is causes something unique. It also does the blockage of the transporter just like Ritalin, but it also is able to reverse the transporter. The analogy here is that it's like a vacuum that's pulling, you cause a vacuum to push. So it's pushing out neurotransmitters. This image right here, this circle, is showing you that Adderall is going to cause these vesicles to be released from the cytoplasmic vesicles. All right. In this image, we look at Ritalin, Adderall, and Vyvanse. The importance here is to show you that Vyvanse, when it gets cut in the red blood cells, it generates Adderall. And this is the lysine amino acid. And why is this done? Is because it circumvents some of the ways that our body degrades Adderall before it reaches systemic circulation. So Schedule 2 drug, meaning it's controlled due to its potential for abuse. A summary here is Adderall is more potent than Ritalin. They are both used to treat attention deficit hyperactivity disorder as well as narcolepsy, which I didn't mention, and they're both controlled substances. The newer formulations help patients not forget to take their doses. Stay tuned for my next video on caffeine.